Hi everyone, good afternoon and welcome to my chat session with you guys today at BabyChakra. So I am Dr. Shradha. I am a dental surgeon. I'm settled in Chennai. I have a multi-speciality dental center in Egmore, Chennai. Uh, I am a periodontal surgeon. I'm a surgeon who works on teeth, gums, uses the laser on adult patients, but I especially love to work on my little children patients that come in. I have kids of the same age, so I guess maybe that's why we attract a lot of kids into our practice, and I especially love it when we have these kids. So today we decided to put as a first topic of our series, we decided to talk about oral health in kids, which is something really close to my heart because I very often have friends, young moms, asking me like, look, I don't know what to do. Should I clean the gums? Should I not clean the gums? What should I do? So we always say that you need a dentist on the panel of even a little child. The minute you have a baby, you make sure you have a pediatrician. So the minute your baby has little teeth, you have to make sure that you have a dentist on the panel. So on that note, I'm going to share my presentation, and I am just opting for a screen share. So I hope that you guys can see the screen. Something easy because there are a lot of pictures to be seen. So it'll be nice if you guys have this. Uh, I hope I'm audible and I hope you all can see my screen. And let's get on to oral health for kids. So it's me, Dr. Shradha. And this is what my practice looks like if you were to come and see it in Chennai and Egmore in the heart of the city. And well, this is how we operate inside. So this is what the inside of my clinic looks like. We have three operatories fully equipped. One especially is for children, and we have a full mouth X-ray system. So our patients don't really need to step out for these X-rays and all that usually happens. And we don't work alone. So I have a huge panel of wonderful doctors supporting me and making sure that all the operations go on. So at their different shifts and their different specialities, it's not only women, we have men who back us too. So we are extremely grateful for our team. And we give great emphasis on sterilization, not just since COVID, but from way before that. And every single instrument that will be used in our practice will be vacuum autoclaved, would have been pouched, would have not been touched with human hands till it directly goes into your mouth by a gloved doctor. Like I said, we have our in-house radiography, and we make sure that we stay in touch with the recent advances because we find ourselves learning something new every other month, and we make sure that we bring all that technology, we bring it back so we can use it and we can stay ahead of our times. And now we'd like to welcome super moms because I know all you guys out here are moms, but I don't think that's enough. I think it's super moms. Why super moms? Because even though y'all are doing the best that y'all can every single day for your kids, y'all are still striving to do better, which is why y'all are here watching me in the middle of the afternoon at 3 o'clock when y'all could actually get some rest or a little snooze time, but y'all are watching me because y'all want to still do better. So you girls are seriously super moms. Now, caring for your teeth, for your children's teeth, there's a very simple checklist. We obviously are going to be doing brushing and oral health care. We're going to make sure that we make them eat healthy. We should also plan visits to the dentist every 6 months. And because we know one thing, there is nothing better than early detection and timely care. Because, if you take your child to the dentist every 6 months and your dentist finds one dot of a cavity and just simply cleans it out and puts a dot of cement on it, your child won't feel a thing, and your child would be like, wow, that was fun, that was easy. And they'll get the whole dental experience. Now they watch it in cartoons and all. If you guys have seen Peppa Pig's Visit to the Dentist, I've watched that cartoon like 100 times over. And the amount of kids who come here and ask for that to be put on while they get their treatment done, so they feel like it was a great experience. But let's say if you hadn't done this timely visit and timely care, and your child goes to the dentist for the first time in their life with a huge cavity, a really painful tooth, a big swelling, a pus collection, maybe fever, maybe being actually sick all over just because of that tooth. And you have to do something really big, like, nick the boil, remove the pus, pull out that tooth, or go in for a root canal, give injections, means that's such a traumatic visit. So we always wish that, you have regular visits so that everything is found at an early phase and your child doesn't have to go into that kind of trauma, and you can always ask your dentist. You don't need to worry about taking your child to a dentist. I'm sure most dentists like me just love to have kids over. The first dentist should be scheduled. The first dental visit for any child should be scheduled at the age of 1 or soon after the first tooth erupt. So that's around 6 to 8 months or the age of 1. Yes, that early. A lot of people don't know that. But the minute you have a baby, you get yourself a pediatrician. So the minute your baby has a tooth, your baby has to have a dentist on their panel. It's very, very important for the first visit to be pleasant. So when you're taking your child to a dentist, you have to inform them that, look, it's the first visit, and please make a great impression, and please keep good time, and they know exactly what to do. So for example, when someone comes to us and we know it's their first visit, we make sure the clinic is relatively empty, and we make sure we call them at a time when they are well rested, napped, well fed, etc. And we also make sure that there's nothing gruesome happening at the clinic at that time, like another screaming uncooperative patient, or maybe a person who's had a surgery done and who's sitting outside with a big ice pack and some cotton in the mouth or something. We don't want them to see all that. So we just keep it really simple, and they get very impatient. So the minute they come in, we make sure that we quickly let them in, and we get their visit done with, so that it's really pleasant and it's not taxing on them. And then you do the same where you routine these visits every 6 months. Food habits for good teeth. So basically, we know there are certain things that are just great to eat, right? Like nuts, almonds, fruits, cheese, yogurt, fibrous foods, fruits and vegetables, because the more you chew on them, the more they'll cleanse your teeth. But there are certain things that are also still a part of our diet, which I can't say are bad, but it's a common thing. You cannot avoid them, and you have them in smaller quantities, but you must make sure that your child rinses or gargles with water after having them. So they are bread, corn, sweets, chocolate. A lot of us are on milk substitutes like Pediasure, Bonvita, Complan, Boost. Anyone with iron supplements, even homeopathic and naturopathic and Ayurvedic medications have some form of sugar in them. Like homeopathy is entirely a sugar pill, right? So all this has to be had, and depending on what the instructions are, even if you aren't allowed to consume water immediately, you must rinse with water. Okay, now some myths, okay, that I want to bust today. Some people feel that I don't need to care about my child's teeth because they're baby teeth and they'll fall off one day any which ways. So a lot of baby teeth fall out even at the age of 12. Tooth decay can cause pain and infection in kids. Your kids need to see a dentist after the age of 1. It's very, very important because you have to preserve these teeth. You cannot let a tooth fall, get a cavity at the age of 2 and expect that it will not cause you trouble till the age of 12. It means it has to be treated. Now, fluoride is a controversial subject. People feel that people look for all these foreign options where, people come and say, look, I got this fluoride-free paste from London, and I called for this fluoride-free paste from, the US. Now, basically, the Western world needs to use fluoride-free products because the government is actually adding fluoride in their drinking water. So when you put your child in a school in London or means in the UK or in the US or in Europe, anywhere, they'll actually have rules and regulations saying we have fluoridated water and we are providing so many part per million fluoride in the child's drinking water, or we are giving a snack and something like that. Here we don't have any fluoridation plans happening in India. So we are only dependent on the super material fluoride from our toothpaste. So please don't go with fluoride free paste, and make sure that your toothpaste has fluoride for your child and for yourself. Since we'll have moms of lots of different age groups here, I am going to be dividing this subject into age-wise. So let's start with the new mommies first. So firstly, congratulations, because you've just had a little baby and you have a 0 to 6 months baby in your arms. You need to keep their gums clean. Even if they don't have a single tooth in their mouth, so do you need to keep their tongue clean, because they are consuming milk all day long, whether it's breast milk or formula. They don't drink water, so they have nothing to flush it out, and they don't yet eat semi-solids or whatever your home-cooked meals. You need to clean their gums and their tongue because you need to avoid fungal infections. You only do it in an outward motion. If you go inward, they will gag. And you don't do this immediately after feeding because you will simulate a vomit. Now, 0 to 6 months, we need to have basically little pieces of gauze, sterile gauze kept, or you need to have muslin cloths. Like, how you have these swaddling cloths, you just need to have them cut into small pieces and kept. At age of 6 to 12 months, your child already has 2, maybe 4, maybe 6 teeth. You need to give your you need to brush your child's teeth. So initially we say you can actually start to brush with something like a finger brush. So for demo purpose, I have a small finger brush. Now, if you put your finger into the child's mouth and you've already been doing it from the time they were small to clean their gums, they are used to it. What they find new is the brush. So you need to give them like a little brush in their hand to play with. And after you finish doing your cleaning, they will also want to try, which is absolutely fine. You're just training them to be independent, but they definitely cannot be independent as yet. They say a child cannot be allowed to brush their own teeth till they are not able to tie their own shoelaces. If you have the dexterity in your fingers and you are able to do a proper bow knot onto your shoelace, then you have the same skill to move your fingertips and to basically brush your teeth inside out. So, having said that, this baby is too small to possibly even wear shoes, forget tying shoelaces. So, the mother, all in all, is doing brushing twice in a day for the child, cleaning the areas where teeth haven't come, still with gauze and muslin cloth. No adding glycerine, honey, nothing. Just a moist piece of gauze, and you moist it with boiling with boiled cooled water because you don't want to use bath water directly into the baby's mouth. And you use a dot of 0 to 2 years fluoridated paste. So this particular paste is not in the Indian market, but we get a Colgate variant from the imported baby stores or Amazon. And there are lots of other Indian variants. Basically, you can choose any brand. You just got to make sure at some place it says 500 ppm of fluoride, like this one says here. So once you have 500 ppm of fluoride, you're good to use it. And coming to what a kit looks like. So a finger brush is what I would be using. The paste I've already shown you, the muslin cloth on the areas of the gums, and what you can give the baby to hold in their own hand. You get this very easily. It's a banana shaped rubber toy. So the child holds it, sees bristles, gets the texture, and also tries to do the same act because they copy you. So this is great. For 1 to 2 year old babies, you have more teeth, maybe even four to maybe even 8 to 10 to 12. They have to brush twice in a day with a kid brush. That's a 1 to 2 years brush. Would look something like this. You brush the tongue too. You mostly keep two of the identical, give one to the child, you use one. The same paste, 0 to 2 fluoridated paste, and you make sure you use a rice grain amount of toothpaste. So this is what your regular dental kit would look like. Uh, from the age of 2 to 5, these kids are a little more fiercely independent. So you basically make them brush twice in a day. They will fight to brush. So caregiver, whether it's yourself or a caretaker, mother, father, y'all make sure y'all supervise the brushing one time in the day. And the child is allowed to brush the other time in the day. But when the child brushes, you supervise. And the child progresses to a 2 to 5 years pace that actually has 100 ppm more fluoride. That's 600 ppm of fluoride. And the child brushes twice in a day, once supervised and once completely done by the adult. So this is what a basic dental kit looks like. Now you have a little older one. So can you see they are missing teeth? So at this point of time, the babies, when they come to our clinic, they've actually lost their first tooth. So we give them a little tiny tooth fairy pillow because this is a pillow in which they can keep their tooth that has fallen down. And they are now on the age where they are becoming grown-ups. They have to progress and use a toothbrush that's a 6+ age toothbrush with a toothpaste that's also 6 years plus that has 600 ppm of fluoride in it. They need to brush all their teeth, the new ones that are coming and the old ones. You can see the new teeth. They kind of have this sharp, spiky appearance, and they look all. Sometimes they even come overlap and parallel. They look a little more yellower. They are not as white. They look much larger in size, and they have spikes at the edge. All this is absolutely normal. The spikes are called mamelons. They help them to penetrate the gums because the gums are quite tight and hard now. After they come out with wear and tear, those spikes completely normalize. That's why we don't have them right now. All our teeth came out the same way. They are slightly yellower because that's the way the calcium content is. They're not as chalky and white as the baby teeth because they were meant to last just a few years. And they are, yes, much bigger in size. Initially, they even tend to look a bit odd because the child hasn't grown to a full adult, and at the age of 6 they have big incisors that are actually the size of adult incisors. Don't worry, a couple of growth spurts later this will absolutely look normal. So this is what a regular pack they look like. They have them in, I think, Spider-Man, Batman, Barbie, a few other for boy, girl. But they're just a flavor difference. So 12 plus. 12 plus is something that we all come under this category. So you brush with an adult, you brush with an adult toothbrush. It's obviously unsupervised brushing because you are an adult. You use a pea-size amount of paste and you use a fluoridated paste. So something like this works just well. A Colgate total of 1000 ppm fluoride. You have to brush and you also need to do interdental cleaning. Now, flossing or interdental cleaning. I'm going to show you more about this, but this is what a regular kit should look like. A good paste, a good brush, choose any brand you like. Just make sure that you get soft bristles and a small size head. So you're basically able to reach everywhere. Interdental cleaning is what the rest of the gadgets show. So this is the regular brushing technique. I actually have a model to show you what these pictures mean. So when you start to brush your teeth, you brush, let's say, the upper jaw first. You're brushing up to down at a 45-degree angle to the gum, and you do it only from gum to tooth. And you also keep a slight vibration in your hand. So as you come down, you're massaging it. You do the same thing and you don't forget to brush the inner surface of your teeth. And the only place you're going side to side is when you're scrubbing the chewing surface of the teeth. Now you do the same thing in the bottom teeth, but then here you're going down to up because the gum is down. You're doing the same on the inside and you're horizontally brushing. This entire process should take you 2 minutes. So as simple as 1 minute of the upper, 1 minute of the lower. If you have great contacts and your teeth are all tight and in great positions, then you must floss every day. Flossing is the act of simply passing a thread in between each tooth surface, because with, like, when you go to a dentist and you say, I can't see the cavity, and the dentist says your cavity is in between teeth. So in between teeth is the most hazardous and dangerous spot as far as getting cavities or gum disease starting. So floss is a thread like that comes in a little spool. Some people are very comfortable doing it like this. But for the ones who aren't, we provide a really simple, straightforward floss holder. We stock these also at our practice. You can contact me if you need some. And we basically ask you to tie it around. And then on a model like that, basically flossing is just the act of passing the thread in between the teeth and cleaning this triangular space. So the model obviously is tighter spaces, but this triangular space, and you basically finish it up and you remove it out. So it's the idea of cleaning the area in between the teeth, because when you're brushing only, you're cleaning only 60% of your tooth structure. Like we said, the outside, the inside, and the top side. But there's 40% of your tooth structure that you're absolutely not cleaning if you've never flossed. So I know it's shocking, but it's never too late to start. If one has larger gaps, like gums have recessed, or one is older, or one has missing teeth, then we also stock interdental brushes. So these brushes again are a great way to clean gaps in between tooth, or a tooth with a big old filling or a crown, etc. So small brushes like that are like baby bottle brushes. They are great. So I get a lot of frequently asked questions, and I thought that maybe we can do a Q&A, or maybe we can just simply run through a few questions that I get asked, and then we can see if I've answered your questions, and then we can take maybe some remaining questions later. So a lot of people say that why are dental problems on the rise? So we say that, look, there is a big like people, grandparents especially, come with the children and say that we didn't have this in our time. Hamare time mein, like, we didn't have to go to a dentist. Our baby teeth just fell and we got permanent ones, and we never had a problem till 30 or 40. So look at the rise in consumption of sugars, sweets, aerated drinks, sugary drinks, fancy chocolates, biscuits, cakes, especially during this lockdown. What not have we eaten to entertain ourselves? In those days, it was just milk, but now there are various milk substitutes. It's not uncommon to see a child and say that the parent says, oh, I've been asked to have like sweetened almond milk, and my child is on soy milk, and my child is on Pediasure or Pediagold. Means it's not an uncommon thing now. So milk substitutes all have sugar. And people are avoiding fluoride paste on the top of it all, because they think that, oh, we got it from America and we got it from UK. But that's not a smart thing to do, to avoid fluoride paste, because we need fluoride to protect the teeth. And maybe routine dental visits aren't taken seriously. and adherence to, brush twice in a day or to introduce floss. So this is where we go wrong. The lockdown has, well, we don't know where we are headed with the second wave or not, but the first lockdown that we saw, we actually, when I opened my doors in the month of July, after the initial 3 or 4 months of keeping the clinic shut, we saw a large number of people who just came in and said, we've snacked like crazy, we've eaten anything and everything, we've baked every other day, cookies, tea loaves, cakes, don't ask. And everyone was on a high sugar diet. And each time you have a sugary snack, like let's say that, I tell my patients that if, your child wants to have, like, let's say, maybe 4 small biscuits, you give it to them in one go and tell them that to be done with it. Because if you tell them that I'm going to give you 4 biscuits over the course of the day, 1 biscuit after every meal, that's the worst thing you can do. Because each time you have something sweet, it takes 45 minutes to 1 hour for your pH to return to normal. And that means for that full 1 hour, your tooth is so susceptible to decay and break down, and bacteria can drill a hole, and the tooth can actually get destroyed. So doing that once in a day is one thing, but doing that 4 times in a day is something else. So you eat whatever you need to at one go. So people say that eating too much sugar causes decay. I say no, eating sugar too many times causes tooth decay. Now, why is it important to treat baby teeth? Sorry. Yeah. Okay, yeah. So I have a few more questions coming in even out here. So we continue with these because a lot of them seem to be overlapping. So why is it important to treat baby teeth? Your baby teeth actually are maintaining space and they're holding a seat for the permanent teeth. So it's like saying that, if I were to, like, let's say I was sitting in a crowded bus and I want to, or maybe a crowded train, and I want to step out and I want to go and, maybe go to the door and come back. If I don't keep somebody else to hold my place, when I come back, is my place going to be there? No. So you imagine this is a crowded mouth. Your baby tooth, your baby incisor is holding a place for the big incisor. Your baby canine is holding a place for the big canine. Your baby molar is holding a place for the adult premolar. So if at all you don't treat these teeth, or you just say that, oh, it's gone bad, we'll remove it off. So what? Anyways, it's going to fall. Your tooth is no longer holding the place for the next one. So what's going to happen? All the other teeth are just going to get a little more comfortable. They're going to tip. They're going to occupy the space. When the big one is ready to come, what is it going to do? It can't make its own place. So it's going to come out. Then we call that as extra tooth or Dracula tooth. People come and say, oh, it's going to come inside and it's just going to be parallel. And this child, for no rhyme or reason or no fault of theirs, is going to be susceptible to a long braces treatment. And in the meanwhile, crowding, you will get, so it could be a nutritional problem because you don't have enough teeth, you can't bite, chew, so you'll opt for all the unhealthy things because you'll say, I can't eat all the hard, healthy, the fresh salads and fruits, and also you eat all those soft processed things. Some people come with a speech constraint, so you have a lisp. It spoils your cosmetics. It will lead you to painful, extensive, long procedures, and it will have an effect on the permanent tooth. So it's so important to treat baby teeth. Is all dental treatment painful and scary? No. Dental treatment comes in various stages. If you come to a doctor when you're at stage 1, let's say a dot of decay only on the enamel, very straightforward, 5-minute filling, easy on the doctor, easy on the patient, reasonable on the patient, quick and simple, and not painful at all. You come to the next stage, which is advanced. The patient might have a dot of sensitivity at the end while drilling close to the dental. You come to stage 3, for sure it's a painful treatment. You or your child, anybody would require shots, anesthesia, more drilling, and then you'll be like, I should have come earlier. By the last stage, it's properly a root canal and it's a multi-visit treatment, and it's painful and it's expensive. So then we end up feeling that, oh, this is going to be expensive or troublesome or painful. But the same thing would be easy had you come at stage 1. So there's no substitute to regular 6-monthly dental checkups. So like you can see, if one is at stage 1, the first picture just has a few small white spots. Believe it or not, those are incipient caries. This is the first stage of decay. And at this stage, I don't even need to pick up a drill and make a hole in the tooth. We simply give the patient fluorides. We apply fluorides in the dental clinic, and we make sure that we monitor this patient, and these white spots will reverse. And they'll actually be like decay. Have you heard of decay that reverses itself? This is the decay that can reverse itself. It's called incipient caries. You can look it up on Google. The second stage, where you already see these brownish dots, This is the stage in which we need to make tiny boreholes and do a filling, but it's absolutely painless and really quick. The next stage is where you require a little more drilling, probably some more time, and maybe it would be sensitive towards the end. And by the last stage, there's something very little that I can do for this patient. Means there are huge cavities, there are little root pieces which will just have to be extracted, and space maintainers will have to be put. This one tooth that has some structure would probably be a root canal, but there's very little that I can do easily. Some people just believe this is a genetic problem. They say my husband and I have bad teeth, so my child too has to have bad teeth. So there is a genetic hereditary correlation and there is a pattern, but to your good luck, decay is all preventable. So if you know that you're susceptible, you just show up every 3 months instead of every 6 months and get every decay tackled before it becomes a root canal. So at least if you've had 10 root canals by the age of 40, your child doesn't need to have 10 root canals by the age of 40. We can be smart and avoid them. And some people have a question on when will the baby's teeth come. So this is a very standard. You can actually click a screenshot of this page. Nothing to explain in this as to roughly what is the age. So, by 6 to 8 months, you have those two little ones in the front. And then by 30 months, you should have a complete set of baby teeth. So before your child is 3. And people say, when will the tooth fall? So again, this is susceptible age-wise. So so again, you can get a screenshot of this kind of a page that gives you an idea as to your lower front teeth are going to fall between the age of 6 to 7. Also, your upper front teeth will follow, and then you keep losing teeth till the age of 12 or 13. So that's why we say. Another question is, people, now we finished talking about what kind of a brush to use. So people ask that when should I change my child's toothbrush? When it looks like that, for sure. Basically, every 2 months, if it looks like that, or once it starts looking like that. If it looks like that in the first 5 or 10 days of usage, then there's definitely something going wrong, which means your child is just biting on the brush or spoiling the brush. Then you have to prevent that also. And if your child ever gets the flu, any kind of flu, not just a scary big flu, but even a cough, cold, fever, or something like that, the minute they get a flu, they have bacteria in their mouth that are going to get trapped in the bristles of their brush. And we don't follow a great sterilization or sanitation process, like soaking a brush overnight in a solution. So the minute your child gets a flu, you're going to imagine that that brush is infected. You're going to toss that brush because the bristles of that brush are possibly going to make the child sick again. So we don't want that at all. So fluoride is something we discussed, where we believe that fluoride is absolutely a wonder material. It prevents and reverses early signs of decay, makes the tooth structure stronger, makes your tooth little more resistant to bacterial acid attack. That means little acid attack is going to happen. You are going to have citrus, sour things. You are going to have sometimes maybe an aerated drink, chocolate, sweets. So having fluoride would actually make your teeth a little stronger, like you're wearing a jacket in the cold. And it remineralizes areas where acid attack has already begun. So that's just wonderful, right? It's reversing decay. So you need fluoride from an external source, because we don't have fluoride in our water, no fluoride drops, and no school fluoride plans. So we need fluoride from our toothpaste or from our dentist's office, which is in the form of a fluoride varnish or a fluoride material. Is dental decay contagious? Yes, unfortunately. You can spread decay in 2 ways. Vertical spread of decay is you can transfer decay from parents to kids. Can you imagine when you're kissing them, when you're sharing cutlery, when you're cooking their food, you're tasting it and you're giving them the same food. So please avoid doing all this, especially means avoid doing this under any circumstances, and especially if you have bad oral health. Please be very careful about kissing your child on the mouth, sharing the same spoon, straw, food tasting, etc. Horizontal spread of bacteria. So basically, undesirable bacteria can transfer between kids during close contact. So, horizontal is maybe when the children are at school, they're sharing, they're biting, they're eating something from like biting a sandwich and sharing it with another child, or using another child's containers. Be very careful of that. How can I prevent cavities? So you basically should be brushing twice in a day, maintaining good oral health, using a fluoridated paste. You have to clean your tongue. You cannot leave bacteria on your tongue and say, my teeth are really clean. The same bacteria are going to transport themselves back to your teeth. And you are going to floss once at night if you're over the age of 12. You're going to avoid frequent snacking. You're going to do a 6 monthly visit to a dentist. And if at all you do have a tendency to cavities and, teeth have deep grooves and all, and the dentist advises that, just seal these grooves and pits because you've already got 4 teeth with decay. You're going to decay the other molars too. So you can seal them. These are a few questions that patients have sent. So white spots. So we've answered back saying that these are white spots, and you can do a fluoride treatment. And there are stains. So a lot of kids sometimes are on iron supplements, or very fond of pigmented foods. I've had someone who's come in like that on iron supplements. Another one who was just crazy about eating pomegranate every day, beetroot. Basically, the minute you eat something with pigment, you need to eat something fibrous to kind of clean it out. So if you're giving your child something, maybe like beet, follow it with little apple. So the apple will clean it out. Or if you're giving them an iron supplement, immediately make sure they wash off or iron, or basically gargle out their mouth, even if not able to brush. Bad breath. So bad breath in kids is usually due to an improperly clean tongue or teeth. Mouth breathing, because sometimes they have a blocked or stuffy nose, so they tend to breathe through their mouth. Frequent cough and cold, and stomach issues too. And then we would probably ask them to see their pediatrician and look at a deworming. This we already spoke about, where we said that, when the big teeth come, they look like bunny teeth. So nothing to worry. If at all it's serious, later it'll require braces treatment, but most likely, like this fellow in a growing age, all the other teeth around are baby teeth. So of course the big ones look big in proportion. In textbooks, this is actually called the ugly duckling stage, although he looks so cute. But this is called the ugly duckling stage, and every child is going to grow into a beautiful swan. So this is a temporary phase. Correct time to get braces is, according to the American Dental Association, you take your child for a checkup at 7, and between 9 and 7, between 9 and 11 is the right time to start braces treatment. But in today's technology, it's never too late. This is as early as you can start, but there is no end date. You can be 55, you can be 70, and you could want straight teeth, and you could just come in and we could work on the alignment of your teeth. Gaps in babies' teeth, yes, are absolutely normal because they need to keep space for the big teeth that are going to come. And the appearance of the teeth being yellower, again, this is something we discussed. So your permanent teeth will look sharp, they will look yellow, and parents will be like, oh my God, the baby teeth were so nice, but look how these have come. So these are just a few WhatsApp queries I've answered. Pit and fissure sealants is something I didn't elaborate into, but basically your teeth have really deep grooves. And it's sometimes very, very, it's very, very difficult to kind of go into the deep grooves of these teeth. And hence, we actually use a chemical to seal those deep pits, as you can see. And then we make it shallow so your brush can take care of it all. And another thing people say that, so for certain bad habits which are actually not acceptable, thumb sucking, there's something called as tongue thrusting, that each time the child talks, they'll push their tongue out and talk. And mouth breathing, where you see your child always sleeping with the mouth open, and grinding of the teeth. So people come in and say that, all night long, your child is grinding their teeth. These are all things that one should look out for. And up to the age of 3, we kind of ignore these habits. But after the age of 3, we should not ignore these habits because they cause serious harm. And we should look at habit breaking appliances or something so that this habit is gone for good. This is one really important thing, even though it's one of the last few slides, but very, very important to me, is how to avoid dental phobia. I have friends my age who come in till today and they say, I'm petrified, please knock me off, and just give me anesthesia, and I don't want to be awake, and I want to sleep through even my checkup. They're so scared. This all comes from a bad experience as a child. So if as a kid you've gone to a dentist and you've gone with a serious issue and you've directly gotten a shot and you've gotten some screaming, shouting, and you've come out crying, or something like that, you're going to be petrified of dental visits your whole life. So before you take your child to a dentist for the first time, talk to them about very positive, motivational stories. Show them a cartoon video of a positive dental visit, like Pepper's visit to a dentist, to her friend, the elephant's father. I think it was Emily Elephant's father, Richmond Elephant. It was wonderful. She sat on a chair, the chair went up, she sat and she had a pink bubbly liquid with which she washed her teeth, and there was some polishing done, and her teeth were shining bright. It was a wonderful, positive video. I have that playing in my waiting room like all the time. So show them something positive. Take time. Don't take time. Make this visit proper. Make sure they've not avoided a nap or a meal, and you've taken them in a rush. Properly well rested, not hungry, cranky, hangry, nothing. And make sure you inform the dentist that this is the first visit and take an appointment with a good amount of time. Let them go for a regular visit, not something painful or something that has to be looked into. And you manage the timing at the practice. So these are a few of yes, these are the little babies, just a few of them we could fit in, but who've been at our practice, and they love coming back. And this one put me on the dental chair and said she wants to examine me, and another one who got his extracted tooth like a medal around his neck, and another really tiny one who allowed me bravely to finish all the treatment. Again, another one who wanted to wear a mask just like myself before the COVID days. So now it looks normal, but yeah, in those days, she wore a mask. So, yes, this is us, and these are my details. If anybody wants to get in touch with me for more questions or any personal queries, I'll be more than happy to help. And this is our family and our small little dental practice in Chennai. So that's why I wanted to address this subject, and I hope I've been able to maybe knock off some dental phobias, answer a few questions maybe you all were worried about or wondering about, or if nothing, then maybe just educated you all on how to take care and do better. So I hope this was helpful to all watching today. And thank you again for taking this time out and coming to watch. So you can follow me using my referral code on as Shradha, SHRADHA on BabyChakra. So thank you so much for that. And I look forward to answering your questions. So it was great having you guys. Please do follow and